Hi guys, welcome back to the channel. So due to technical issues, last class video was ended abruptly. No issues, will be continuing from there only. Okay, let's start today's class. So last class we were seeing about two exceptions. First was basosquamous cell carcinoma. Okay, then second was skin. So basosquamous cell carcinoma we have finished. We were about to start skin that second exception for the skin squamous cell carcinoma of skin. Okay, so skin squamous cell carcinoma that arises in the area of skin. One second. That arises in the area of skin irradiation damage, burn injury, chronic ulcer, or from what has been called Bowen's disease of skin, which is actually carcinoma in situ. तो यहाँ से जहाँ से भी होता है, they are also exception, मतलब वो भी invade करेंगे, metastasize करेंगे. Okay. So the carcinogen causing the exception in SCC of the skin is either different from UV light or synergistic with it to more severely damage and create more aggressive oncogene expression. तो दिस पॉइंट इज़ रेफरिंग कि जो भी कार्सिनोजन रिस्पॉन्सिबल है फॉर दिस टू एक्सेप्शन, या तो वो कुछ और है यूवी लाइट के अलावा, या उसके साथ सिनर्जिस्टिक है, मतलब उसके इफेक्ट को ऐड ऑन करता है. तो इसलिए ये जो भी ऑन्कोजीन एक्सप्रेशन होगा वो मोर अग्रेसिव होगा. Now coming to differential diagnosis, first one is actinic keratosis, second one is basal cell carcinoma, third one is lentigo-maligna melanoma, fourth one is melanoma, and fifth one is keratoacanthoma. So we have dealt almost everything in this, only melanoma is left, I guess. Okay. Now coming to the histopath part, it is a well differentiated keratin producing tumors that are histologically identical to their oral mucosa counterparts. So they are well differentiated and they are keratin producing tumor and they are histologically identical to their oral mucosa counterparts. A variant known as adenoid or acantholytic squamous cell carcinoma that also tend to occur in sun-damaged skin and sometimes on the lower lip vermilion. This type is characterized by marked acantholysis which creates a gland-like pattern. Okay, adenoid, जो जहाँ पे भी word adenoid आएगा, referred to it as a gland like. Okay, adenoid word जहाँ पे भी यूज़ होगा कोई भी चीज़ में, अगर वो स्क्वामस सेल कार्सिनोमा है और इट्स टाइप ऑफ अमीलोब्लास्टोमा एनीथिंग, तो एडिनॉइड मीन्स ग्लैंड लाइक. तो या तो उसको एक्रेंथोलाइटिक भी बोलते हैं. ओके, तो इसमें ये बोल रहा है कि इट इज़ अ वेरिएंट विच हैज़ अ which shows marked acantholysis and which create a gland-like pattern. It also occurred in same sun-damaged skin and sometimes on the lower lip also. तो हिस्टोपैथोलॉजी पार्ट में ज़्यादा नहीं है बिकॉज सेम एज ओरल म्यूकोसा, इट इज़ सेम, तो इसमें ज़्यादा नहीं है. ओके, नाउ कमिंग टू द ट्रीटमेंट पार्ट. Now in treatment part, lesion responsive to topical 2% 5-FU should be excised with 5 mm margin and margin should be assessed with frozen section. तो वो लीशन जो कि टॉपिकल 5-FU फ्यूरोयूरासिल से अनरिस्पॉन्सिव है, तो उनका एक्सीजन करना है विद कीपिंग द 5 mm margin and margin should be assessed with frozen section. If the margin are free of tumor and the tumor thickness is less than 4 mm, no further excision is required. और जो भी margin में अगर that is free of tumor and there is और जो tumor का total thickness है वो 4 mm से कम है, तो further excision हम लोग को नहीं चाहिए. Now, in most cases, primarily closure can be accomplished. In moderately sized excisions, local advancement flaps are recommended. तो अगर मॉडरेटली साइज एक्सीजन है तो उसमें हम लोग लोकल एडवांसमेंट फ्लैप देते हैं बिकॉज दे हैव द आइडियल कलर मैच एंड द थिकनेस, ओके, कंपेयर टू डिस्टेंस फ्लैप. So that's all for today's class. We'll be continuing the treatment and prognosis part in the next class. Till then, like, share, subscribe, and comment. Bye.